Welcome to Lessons in Leadership. Steve Adubato with my colleague, Mary Gamba. Mary, we kick off the program today with Bob Garrett, who is the Chief Executive Officer at Hackensack Meridian Health. Good to see you, Bob.
Good to see you, Steve.
Now, Mary, did you know that Bob Garrett recently was selected? And it's the NJ Biz Healthcare Leaders, Bob, #1 in the state?
That's what I heard. Listen, I'm honored to be on the list, but as I've often said, and you know this, when I come home at night, still got to take the garbage out. Not necessarily #1 in the house, but listen, I'm honored to be on the list. It's a great honor for all of my colleagues at Hackensack Meridian Health.
And check out NJ Biz, our longtime media partners. That list of healthcare leaders, it's an impressive list. Well done. Hey, Bob, let's kick this off with a conversation that you and I had offline. To disclose, I've done leadership and communication coaching at Hackensack Meridian Health for over a decade. And recently, Bob and I had a conversation about, quote, the mental health moonshot. What is the mental health moonshot and why is it relevant to leadership and in these very challenging times?
When I think about the mental health moonshot, it's really a call for action for government, for the private sector, like healthcare providers and insurers, to all get together and let's tackle the mental health crisis that we're facing. I think about a generation ago, I think it was President Nixon, Steve, who called for a cancer moonshot. And
right.
The objective was to reduce the death rates in cancer, and over a generation, the mortality rates actually did come down between 30 and 35%. So it can be done. And when I think about the mental health crisis today, I mean, it's really a pandemic within a pandemic. Over 25% of adults and children are suffering from mental illness or behavioral health issues. 1 in 3 high school girls are reported contemplating suicide. Addiction rates are up significantly. So we have a real crisis. And I think we need to really focus on expanding access to care, coordinating care. Let's once and for all get rid of the stigma that exists around mental illness. It's an illness like any other chronic disease out there. So my call for a moonshot is all about really a call for a coordinated action that we can do together, government and private sector.
Well said. Mary.
Yeah, I'd like to pivot a little bit, Bob. Definitely mental health is super important. And another hot topic right now is artificial intelligence, AI. It's out there. We have to embrace it. Every industry. Can you talk a little bit about AI, how it's impacting healthcare, and what that future is going to look like with AI in healthcare?
You're absolutely right, Mary. I mean, you can't go anywhere without hearing about AI out there, whether it's in healthcare or in other industries. And I think it'll really be one of the most defining tasks of the 21st century to harness the power of AI. And in healthcare, it can really be profound, and I think really can make a difference in transforming healthcare. It has the promise of honestly producing much better healthcare outcomes, predicting disease earlier on, making healthcare more efficient, and therefore providing value back to the communities that we serve. And let me give you a couple examples. And there's some great AI stories out there that healthcare providers are embarking on. But at Hackensack Meridian, we have several AI case pilots that are going on, use case pilots. And one is an example where we've developed an AI algorithm that can actually predict advanced kidney disease before people actually have symptoms. And that's going to give clinicians an incredible jumpstart on trying to prevent that kidney disease from coming on. So it can actually save years of dialysis and maybe even avoid a kidney transplant down the road. That's just one example. There are so many others, that are out there. We have a algorithm out there now, an artificial intelligence algorithm that is helping radiologists to prioritize scans. Think about this: the average radiologist has to read 200 scans a day. And through artificial intelligence, it can help them prioritize those that are most problematic so that treatment plans can start that much quicker for patients. So those are just a couple examples, but there's so many out there, and not just at Hackensack Meridian Health, but healthcare systems, hospitals, physicians are really getting into AI and embracing it in a big way. I will say one thing, though, just as a word of caution. we have to be sure that as we develop artificial intelligence, particularly in treatment plans, or we use it as a tool for diagnosis, that the data is accurate, that it's not biased, that we're protecting patient privacy at all times. So governance is real important. We've set up a very extensive governance system within Hackensack Meridian. I would urge others to do the same and make sure that every step along the way that there's at least human intervention or a human oversight, because it's not going to replace what human beings can do.
So, it's not about being for or against AI. It's about, obviously, and I'm not here to offer commentary, but it's not going away. You have to embrace it, manage it, and also balance all the pieces to the complex equation of AI. Hey, Bob, here's another interesting thing. I was looking at, it was both on NJ Biz and ROI. There was a story about Metro Park, which Metro Park is a major hub, transportation hub. For those who've been on mass transit, Mary, it's actually close to where you grew up, right?
It is definitely close to where I grew up in Fords. Yeah, Steve often says that Fords doesn't exist, so we'll say it's close to Island, Woodbridge, but my hometown. Yes.
Right.
All right.
But here's the thing, Bob. The governor was recently there for a groundbreaking of a talk about innovation and discovery, a very important healthcare innovation tied to Metro Park and the transit system there. Talk about it.
Yeah, so, Steve, more and more healthcare is moving outside the four walls of the hospital. People want healthcare closer to their homes, maybe even in their homes. And what a natural thing to do to really build a health and wellness center located at a major travel hub. I mean, if you think about it, it provides great access, unprecedented access to care. It's the first really that we know of in the nation that's going to be right at a travel hub. And Metro Park is one of the busiest, and actually getting busier by the day, in not just in New Jersey, but across the Northeast. So it's a project. It's going to be 240,000 square foot health and wellness center, $200 million project. We're happy that we've teamed up with the state of New Jersey, and we did have the governor on hand for the groundbreaking. Through the EDA, New Jersey EDA,
Economic Development Authority, Tim Sullivan, our friends there. Go ahead.
Yep. We're creating 1,000 new jobs for the region, and therefore we've been awarded a tax credit of $113 million to get this project off the ground. But what it will do is provide unprecedented access for patients, for providers. Think about this. Amtrak is upgrading their Acela trains. So in a couple of years, from downtown Philadelphia or from Midtown Manhattan, you can get to Metro Park in less than 35 minutes, which is incredible. So whether you need primary care or medical specialties, surgical specialties, urgent care, we'll have it all there, and with an unprecedented access to mass transit. I think it's going to provide access like never before to the people of New Jersey.
Mary, before we let Bob go, you and I have this conversation all the time, and I was quoting Bob's a sports not fanatic. About the Giants. Right. He is about the Giants. You are.
I obsess a little bit about the Giants, Steve. Yes.
But as we do this program, March Madness playing out, we're taping on the 2nd of April. We'll know who the national championship, both in women and men's basketball. But I was quoting Coach Danny Hurley at the University of Connecticut, who said, "Complacency is our enemy." Do you believe the same thing, don't you?
I do. You really need to embrace change. You need to embrace innovation, and that I've been optimistic my entire career. I've been in this field for over 40 years now, Steve, and I'm as optimistic, if not more so, today than I was back 40 years ago. When I think about, as we talked about before, artificial intelligence, technology that can really transform healthcare like we've never seen before, it gives me great hope. And we need to embrace that kind of technology. I think we're finally addressing, as a healthcare system across the country, we're finally addressing health equity. That we can't transform healthcare with inequities that exist based on where you live or the color of your skin. And then the other thing that really gives me hope, for the future is when I talk to, as an example, our medical students at the Hackensack Meridian School of Medicine. Oh my gosh, they are great young individuals. that give me hope and inspiration. They're focused on prevention. They're focused on wellness, on improving the health of our communities, and their real dedication to compassion in medicine. Oh my gosh, it makes me very optimistic about the future. So yeah, you can't be complacent. You got to address new technologies. You got to address change, and you got to get back down to the basics too, like compassion in medicine. Pretty simple stuff, but it really is going to be important for the future.
I remember Bob told me offline it was from his dad that he got his optimism, right?
Yes.
Yeah, always
God bless,
positive.
92 years young and still optimistic.
And what did he do professionally, Bob?
He was a pharmacist, so that was one of my inspirations to go into healthcare.
Yeah, you got to be optimistic and positive in these challenging times. Bob Garrett is the CEO of Hackensack Meridian Health, one of our longtime underwriters on the Caucus Educational Corporation side, and I'm proud to do coaching, leadership, and communication coaching there. Thank you, Bob. We appreciate it.
Thanks so much for having me.
You got to stay with us. We'll be right back. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, Fedway Associates, Inc., the Port Authority of New York and New Jersey, Veolia, Resourcing the World, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Mary and I are pleased to be joined by our longtime colleague and friend, Dennis Wilson, President and CEO, Delta Dental of New Jersey, Delta Dental of Connecticut, and also back by popular demand, John E. Harmon, Senior President, Founder and President and CEO, African American Chamber of Commerce in New Jersey. Good to see you, gentlemen.
Delighted to be here.
Now, Dennis, tee this up. This is part of our small business leadership series. Why are we doing this conversation, having this segment with our longtime friend, John Harmon? What does it have to do with small business leadership?
Well, I think it has everything to do with small business leadership. You know, when you sort of think about associations, value-added think tanks, best practices, and so forth, you know, organizations like John's, the African American Chamber of Commerce, certainly do that. They are a forum for best practices and create the linkage between organizations like us and the business community.
John, jump in there. Tell everyone what the Chamber is, because it's so significant as we put up the website. And we'll also put up the website for Delta Dental as well. Go ahead, John.
Well, thank you again for this opportunity. And just to piggyback off what Dennis was saying there, you know, the African American Chamber of Commerce of New Jersey, I think our role specifically is connecting the 1.2 million Black residents and over 88,000 Black businesses to an ecosystem where resources and opportunities and information exist. Many of our businesses are first generation, so they don't have a long history of being in business. So being able to leverage those strategic partners in a way that will impact the state's economy in a way that makes it more competitive. That's kind of a long way of saying we're part of free enterprise and driving capitalism and advocating for businesses in the state.
Well said. Mary.
Yeah, Dennis, I'd love to talk a little bit about the value add. John was just talking about the benefits that the Chamber provides. I know that you have worked very closely, Delta Dental of New Jersey has worked very closely with the Chamber and others to provide value to the people that you serve. Can you talk a little bit about that and why that is so important, especially when it comes to the partnerships that we're talking about?
I sure can. So when we're talking specifically small business, and let's define that a little bit. Let's call that businesses that employ under 100 people, let's say. I think that's a good barometer. And there's even sub-segments underneath that. But regardless, a small business, there's no reason that a small business cannot offer big business type of benefits. The value that that big businesses have to attract talent and to keep talent. For example, in our business, it's dental benefits, it's oral health, it's vision, right, and everything that's attached to that. We have programs that range all the way from businesses from 2 or even sole proprietors all the way up to infinity. And there's several aspects of what we offer that are the same that we offer companies that are much larger, national in scale. So to get the message across that small businesses can have big business benefits to attract needed talent and to keep individuals within a company being productive and advancing is really good. And working with the African American Chamber of Commerce, there's a linkage there. There's another voice that can echo what I just said and help us deliver that value proposition.
That's good stuff, Dennis. John, jump back in here because you in a previous conversation, you said that your organization is a convener. Talk about what that means, a convener, and connect that to convening partnerships, relationships, and actually taking advantage of what Dennis just described. Talk about that.
So, we recently had a consultant that met with the staff and talked about really defining who we are. And one of the terms was convener, caretaker, connector, right? So the benefit of the African American Chamber of Commerce of New Jersey having a relationship with an organization like Delta Dental is that businesses may perceive that although they may desire to have good oral health or preventative health around the mouth, they may see that as something out of their reach because they're a small business. And so our ability to make that introduction or serve as the bridge, if you will, to Delta Dental and allow their professionals to share with them that this goes beyond just cleanings and extractions. There's so many things as a result of bad oral health that can affect other parts of your body. And so that's an additional benefit if that relationship happens to come to fruition following our introduction that provides mutual value to our member, to both members, the small business as well as Delta Dental, but also gives us credibility as that connector or the convener of that engagement.
Interesting. Dennis, as John talks about the partnership, the collaboration, the being a convener, bringing people together, the other partnership, and John's very well aware of this, is that, and I'm honored to be a part of this, along with Randy Stoddard, who leads up the marketing and communications team at Delta Dental. There's a relationship between Delta Dental and Special Olympics of New Jersey. There's an annual golf tournament that's actually, as we're taping this program, that's coming up soon. This may be seen after. That raises a lot of money for Special Olympics. They're a partner, of Delta Dental, but also we're talking about a special needs population as it relates to oral health. Please, Dennis.
Yeah, thank you. I appreciate you raising that. We've been a very solid partner with Special Olympics of New Jersey for over 30 years now. It's actually 34 years that we've been with them and helping them along. And we feel just an affinity for what they do, how they do it, and what they mean to New Jersey, for those athletes, for the families, and for the workforce, quite frankly, but specifically on a special needs benefit. And we are the only one in the space, to the best of my knowledge, that's offering this. And quite frankly, I offer a challenge to everyone else that may be watching that's a competitor to do the same, because I think it's that important. We offer a benefit for those that have special needs, if you will, and emotional disability, a physical limitation that is on the spectrum, and a host of other disabilities that confront an individual that make it difficult to get that necessary oral care. So we've attached a benefit, and we don't charge for that benefit. It is free. Every single one of our customers was offered this free of charge, and every single one of our new customers gets this free of charge. And it's expanded services specifically for the aforementioned populations, even those that have significantly high anxiety and clinical anxiety around going to the dentist. We offer benefits in accordance with that, so folks can be seen that they can get their oral health and that they can be on that good track towards overall health that John had referenced.
And again, honored to be a small part of that very important initiative, particularly that golf outing that raises so much money for Special Olympics, sponsored by Delta. Mary, let's try this before we let John and Dennis go. You and I have talked about partnerships sometimes being challenging because different organizations have different agendas and cultures, et cetera. I'm curious about this. Mary and I, our business is about partnerships. But John, for you, you have so many collaborations, so many partnerships. Is it fair to say that, I'm not trying to be negative, but the more partners involved, the more challenging the partnership?
Yeah, I mean, I think that's a fair assessment because, you know, discerning what people's true motivation is could be difficult, right? Trying to align missions around mutual benefits. This whole conversation across the country about DE&I, right? I get into conversations with people who don't look like me, but they have other issues or missions, and they want to collaborate. And so it's difficult when
what's the payoff, John? John, what's the payoff for it? Even though it's difficult, there's a payoff.
Well, ultimately, the goal is of a mutual benefit, because if it's not, someone's being exploited, right? And so what I was trying to get to, given that Blacks are at the bottom, if we look at all the social and economic situations, and trying to partner with someone that at the same time show that we do have value. This is not a charitable endeavor, but we need to be clear on what we're trying to accomplish through these relationships. And I think if you're clear, Steve, you avoid any difficulties up front, defining expectations. I think that's the critical point. And if you do that, the relationships tend to work out in a mutually beneficial way.
Hey, Dennis, last words on that. Partnerships can be challenging, but partnerships also allow us to do things that we could never do by ourselves. Fair, Dennis?
I think that's fair, and I would say not only partnerships can be challenging, I would say that partnerships should be challenging, because I think the openness to hear other points of view, to hear other perspectives, to get other ideas that we may not agree with or have experience in, I think only creates a better and greater good and better collaboration and more lasting relationships.
Yeah, Mary, we would not be able to do what we do if it were not for all the partnerships, our partners in public broadcasting, our partners with our underwriters and sponsors like Delta Dental, and with folks like John, John, I think we lost count of the number of times you've joined us to talk about a whole range of, that's a partnership. I mean, someone says, well, someone's just a guest. No, they're someone who you know is going to bring it every time and add to what you're doing. It makes you better than you would be alone. To John, to Dennis, we wish you all the best in the ongoing partnership. And Dennis, I believe we have a golf outing coming up that you did not want to play with me in the foursome, but I somehow worked my way into your foursome, raising money for Special Olympics. Are you allowing me in your foursome?
Yes, you are officially allowed in the foursome. You are under the tent, Steve. Absolutely. You're part of.
Thank you, Dennis. Thank you, John. Sorry for cutting you off. Mary and I will come back with some final thoughts on leadership right after this.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague, Mary Gamba, has been provided by NJ.com. NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media. Welcome back to Lessons in Leadership. Steve Adubato with Mary Gamba. Hey, Mary, I want to talk about leadership and how one communicates in a difficult situation that shows strong leadership or not so strong leadership. Mary, do you remember this book? I was not as gray then.
Yeah.
This
Oh
book-
my gosh, look at that.
What were they thinking?
Yes.
Crisis communication, the good, the bad, and the totally clueless. This was
Mhm.
published. I don't even know when it was published. You know what? I signed it to my wife. She never read it. That's why I have it here. So this book was published, I think, Mary, 2000 and
I couldn't even guess.
2010. Okay, you ready? So why am I talking about this? Scarlett, can you get this? This is, I don't know, we're taping this in April. I don't know what's going to be happening. This Shohei Ohtani story. I don't know what the deal is. The deal here, Mary, do you know this story?
I
about
do,
the
yes,
gambling?
but I'm curious your perspective on it. But yes, I'm aware.
So you may ask, why are we talking about this? Well, because I look for any reason to bring in sports.
Of
So
course.
here's the thing. I don't know if Shohei Ohtani, who is an extraordinary baseball player, I don't know if he bet on sports. I don't know by the time this comes out if we're going to find out the story. His interpreter allegedly took money,
It's
no.
so wild.
But Mary, here's the thing. We don't know. The interpreter gets fired. He's the one who was millions of dollars he took from Shohei Ohtani. I know he makes a lot of money. At that point, you might want to know there's a few million missing. So the reason I wrote this book, and the reason it's still relevant, is because when you went public, Mr. Ohtani, you didn't communicate a message that was credible, and then you didn't take any questions. You actually created more questions and controversy by going public and not being clear about it and not taking questions. Mary, we've got 30 seconds left. Do leaders make the crisis or the problem worse sometimes in the way they communicate in public?
1,000% yes. You need to be aware of your body language. You need to be aware of the words that you're saying. You need to be aware of how you're saying them. We coach and train to this. Make sure that you pause, think, because if you don't take
Also,
questions.
don't lie. Don't lie.
And don't lie. Oh my gosh. If anything else, don't lie. You're better off just saying, let me get back to you on that. I don't know. Or the famous, I don't
or I screwed
recall.
up.
Yeah.
Mary,
Or I made a
It's not
mistake.
me.
Or I made a mistake. And it'll be interesting to see in the weeks, months ahead where this story goes, but it's fascinating for sure.
And let me say this, I have no idea what Shohei Ohtani did or did not do. All I know is from a public communication and leadership point of view, it does not look good. I'm Steve Adubato, that's Mary Gamba. If there's anything to admit to, a problem, I will own it, even if it's Mary's fault. No, I'm joking. I'll see you next time on Lessons in Leadership. This edition of Lessons in Leadership is made possible by the Buccino Leadership Institute at Seton Hall University, Prager Metis, Valley Bank, the International Union of Operating Engineers, Local 825, the North Ward Center, the New Jersey Sharing Network, Delta Dental of New Jersey, the Helix, Fedway Associates Inc., the Port Authority of New York and New Jersey, Veolia, Resourcing the World, Choose New Jersey, and Seton Hall University, showing the world what great minds can do since 1856.
This is Mary Gamba. If you want more leadership tips and tools, log on to stand-deliver.com. That's stand-deliver.com.
Promotional support for this edition of Lessons in Leadership with me, Steve Adubato, and my colleague Mary Gamba has been provided by NJ.com, NJBIA and New Jersey Business Magazine, CIANJ and Commerce Magazine, and the Meadowlands Chamber and Meadowlands Media.
Most people don't think about where their water comes from, but we do. Veolia. More than water. Resourcing the world.